Who's there? Okay. Hello. Good morning, everyone. Myself, Dr. Shweta Sonwalkar, Clinical Head and Fertility Specialist at Oasis Fertility, Belagavi. Today, I am discussing regarding endometrial receptivity array test. What is, in short, it is known as ERA. ERA test, it is a test developed in 2021 by iGenomics after more than 10 years of research to evaluate the endometrial receptivity. ERA is the first diagnostic test that determines each woman's unique personalized embryo transfer timing. Test uses NGS, that is next generation sequencing technology, to analyze the expression of 248 genes related to endometrial receptivity status. After sequencing the genetic material, that is RNA, from endometrial biopsy, it is possible to evaluate if endometrium is receptive or non-receptive. 10% of cases, it may necessitate performing a second endometrial biopsy. The endometrial factors plays a key role in implantation. ERA determines when the endometrium is receptive. That is, it detects window of implantation. So what is implantation? Implantation is a process by which an embryo attaches itself to the uterine wall, that is endometrium, and then invades into the deeper layer of the endometrium. Successful embryo implantation mainly depends on a functionally normal blastocyst, receptive endometrium, and coordinated cross communication between embryo and endometrium. And receptivity means ability of the endometrium to allow normal implantation is termed as receptivity. So this is a period of endometrial maturation during which trophectoderm of the blastocyst can attach to the endometrial epithelial cells and subsequently proceed to invade the endometrial stroma and vasculature. And window of implantation is when the endometrium is receptive to blastocyst acceptance and subsequent implantation. It has been postulated to open 5 days after endogenous or exogenous progesterone action and closes 2 to 3 days later. So this process is mediated by immune cells, cytokines, growth factors, chemokines, adhesion molecules, and many other compounds. This window of implantation is disrupted in some of the cases, like a suboptimal endometrial receptivity is suspected to be at the origin of 2/3 of implantation failures. The causes being congenital anatomical causes of the uterus, like congenital uterine anomalies, then fibroid or myomas of the uterus, endometrial polyps, uterine adenomyosis, then intrauterine adhesions, and thin endometrium, some immunological factors which affect the endometrium, altered endometrial microbiota, endometriosis cases, PCOS cases, and hydrosulfins. These all causes alteration in the endometrium. So this ERA test is indicated especially in women patients who have had embryos with good morphokinetic characteristics, that is, embryos of good quality but have not achieved the pregnancy. Therefore, embryo implantation failure is one of the situations in which ERA test is most frequently used. that is in patients with repeated implantation failure, that is more than 3 IVF failures even after transferring good quality embryos. So in natural cycle, this window of implantation, it is generally 8 to 10 days after the ovulation. Whereas in women undergoing IVF, this window of implantation, it opens 5 days after the progesterone intake. That is, which is indicated in generally by P plus 5. But in approximately around 30% of the women implantation failure patients, this window opens slightly earlier or slightly later than P plus 5. That is either on P plus 4 or P plus 6. So, this may explain why some patients experience IVF failure despite having good quality embryos. So ERA detects gives the results when the endometrium is receptive, most receptive, and we can discuss regarding the embryo transfer on that receptive date. ERA test involves 4 steps. Step 1 is obtaining an endometrial biopsy during a mock cycle. Mock cycle powers the same protocol used during embryo transfer cycle, but rather than transferring an embryo, we would obtain an endometrial biopsy and it is sent to the laboratory for analysis. And the third step is we get the results within 15 days and we can discuss with the patient regarding next plan of treatment. And ERA test identifies 4 stages of receptivity, that is whether the endometrium is pre-receptive, post-receptive, non-receptive or receptive. And a receptive test result means patient's window of implantation is within the expected time frame. In such cases, embryo transfer is recommended in the same time as when the endometrial biopsy was taken. Pre-receptive test results means a patient may have the displaced window of implantation and the endometrium is not receptive to the embryo. In such cases, embryo transfer is recommended later than when the endometrial biopsy was taken. And post-receptive result means patient may have displaced window of implantation and the endometrium is not receptive to the embryo. So embryo transfer is recommended earlier than when the endometrial biopsy was taken. And non-receptive test results means patient may have displaced window of implantation and the endometrium is not receptive. In such cases, patient may need a repeat biopsy for ERA test. So when the second biopsy is needed, if the test result is like proliferative phase, endometrium is not exposed to the progesterone and it is unresponsive. In such cases, new biopsy is recommended. And early pre-receptive, that means patient may need 2 more days with progesterone treatment to reach the receptivity. In that case also new biopsy is recommended. And post-receptive, here the patient needs 1 day less with the progesterone exposure to reach the receptivity. So these are the cases they need repeat ERA test. And endometrial receptivity test timing of the biopsy is like in natural cycle. Endometrial biopsy must be taken on the 7th day after the LH surge. That is LH plus 7. Whereas in case of HRT treatment, that is hormone replacement therapy cycle, endometrial biopsy must be taken on day P plus 5 after proper estrogen priming with 6 milligrams of estrogen per day. Then proven to be a reproducibility for at least 36 months, always that the following is accomplished. Suppose endometrial preparation protocol must be exactly replicated for biopsy and transfer cycles. Endometrial thickness must be within the same range from one of the following three, that is less than 6 mm, 6 to 12 mm, and more than 12 mm of the endometrial thickness in both biopsy and transfer cycles. Changes in the BMI must be accompanied by shift in the window of implantation. So ERA test might need to be repeated after significant BMI changes. That is changing more than 30 or to less than 30. So repeat ERA test is needed. Intervention at uterine level may affect the window of implantation. If patient requires intervention, such as any surgeries for myomas or intrauterine adhesions, ERA should be done after the procedure. Endogenous progesterone less than 1 nanogram per ml within the 24 hours prior to the first progesterone intake. Limitations of the ERA test: it does not demonstrate an abnormality in 75% of the patients with recurrent implantation failure. Then it is like cost and it is time consuming. It need for it needs embryos for vitrification. Then ERA assesses 248 genes, where studies suggest that more genes need to be included. So accuracy and reproducibility of the ERA is superior to histology as a diagnostic method for endometrial receptivity. Thank you. Any questions? I am free to answer. When is the best time in my cycle to schedule the ERA test? Before patient, like in cases of recurrent implantation failure patients, so before going to next IVF cycle, ERA is recommended in any of the menstrual cycle before IVF. How long will it take to receive the results of the ERA test? Reports will come within 15 days. How will the result of the ERA test affect my fertility treatment plan? Definitely, it affects the treatment plan because ERA detects endometrial receptivity. When the endometrium is receptive, that time if we transfer the embryos, chances of pregnancy rates are very high in cases of recurrent implantation failure patients. Thank you.